I'm very pleased to welcome our first guest here in studio. Mr. Scott Pankos is a special consultant with a company called Imaging3 Incorporated. Their stock symbol is IGNG. Scott, welcome to the show.
Thank you. It's good to be here.
Now, Imaging3 is a medical device imaging company. Can you give us a general overview of what you do?
Yes, Imaging3 has a breakthrough technology. It's called SmartScan that will provide in real time a 3D X-ray image of the human body, either for diagnostic or therapeutic purposes. And so I want that to sink in for a second. This is real time, a 3D image that a doctor or clinician can rotate on any axis on the screen to look inside or around a particular joint or the spinal cord, for example. So it's quite impressive, and it took software engineers from Jet Propulsion Labs and NASA to come up with the thing. So we take this technology, we employ it into this big O-ring machine that you can stick a body part in or an entire human body. And we'll be selling this to hospitals and clinics for about $500,000 to $750,000, depending on the functionality.
Now, what would you say, Scott, are the distinct competitive advantages that your device has over what we would refer to as the status quo?
So think of the SmartScan technology as the Swiss Army knife of the radiology department. So suppose you've got a bone spur in your knee. You may have had experience like this where you go to the doctor, they send you to the X-ray department, and you get shifted around as they try to come up with 2 or 3 perspectives on the knee joint so you can appropriately locate the bone spur. It's quite cumbersome. So with our SmartScan technology, you stick the bone joint into this O-ring, and virtually instantaneously you come up with this 3D image. Wow. Where again, the doctor can rotate it and within seconds locate the exact location of the bone spur. So it's much more efficient. So now so it's much better than a simple X-ray, which is a simple set of 2D images. So now suppose you've got to get a catheter or something up your spine, which happens a lot given all the back problems that people have. So what happens there is you get kind of flopped over a table, and the doctor or the technician will position a C-arm. Usually they'll do a top-down perspective, and the top-down perspective gives them some guidance. This is a video X-ray called a C-arm or fluoroscopy device. And that will enable them to try to position this catheter or whatever it is up the spine. The problem is that's just a single perspective. Yeah. What they often have to do, because they can't get the depth right, is they will reposition the C-arm while you're still flopped over the table, by the way, so that they can get maybe a side-by-side view, which then gives them depth perspective. That's very cumbersome, and it can take quite some time to do. Contrast that with our SmartScan technology. It's an O-ring, remember, and so it's getting constant perspectives at any moment. So you can have side-by-side a top-down perspective and a side-by-side perspective, and you can do a diagonal if you so choose. And imagine advantages as well if you get caught on something, there's something hidden there, the clinician can order up real time an immediate 3D rendering of where they are, so they then can make their way around something or through a valley or whatever that's in the spine. So it is a much improved simple X-ray and a much improved 3D video X-ray machine.
So obviously it's far superior to a simple X-ray or a simple C-arm. There anything else that this technology can do? Yes,
it also has a slice-through capability, which is what a CT scanner does. So ours is not a CT scanner, nor does it profess to be, but a lot of doctors will need that capability of slicing through a knee joint or through a spinal cord and looking inside and out. And so a lot of hospitals and clinics aren't big enough to afford a CT scanner, which costs full in $3 million, maybe
Wow.
$4 million. It's not portable. It has its own kind of battery system and generator involved, as opposed to our machine, which is portable, plugs into a regular outlet. And so a hospital can now do some CT type scans rather than outsourcing that to a separate facility, which takes a lot of time. They're not getting the revenue, and it's a cumbersome process. So what this does is it increases the throughput for the hospital, the clinic. All these things take much less time. There's a lot less chance for an error. So you have a better profit and loss statement for the hospital. And more important, you have greater patient satisfaction. They're not flopped over the table quite as long. There are fewer errors, and so we think this contributes to a better situation for the payer, the hospital, and for the patient.
Well, this is impressive. I mean, such capability. What about the size of the market? Have you determined the size of the market yet?
The market is sizable and growing. When it comes to X-rays and the video X-rays, or the C-arms, the market is over $4 billion globally, and the U.S. is almost half of that. The CT scanners, again, we don't compete directly with them, but we will take some of that share because of our advantages. That's about a $2 billion marketplace, and again, the U.S. is about half. So we think that that given the advantages, the higher throughput and the fewer errors and the lower insurance costs, less litigation and all that, we think we have an opportunity to grab a reasonable percentage of these types of markets.
Well, Scott, I know that medical, regulatory requirements for medical devices sometimes are no picnic, but when do you expect to refile again with the FDA?
Yes, the regulatory requirements can be stringent, but we have employed a consulting firm called Biologics out of the DC area, a very impressive group of former FDA officials, and they are working with us on the strategy to get the 510K approval through the FDA. That basically relies on a predicate device that already is approved, and if we can show that our device is substantially similar, then we should get approval. The first part of that is getting the software certified. There's a very impressive firm called Crytek that has already performed the certification process. So we're just waiting for the final paperwork on that. So we think in the next few months, we will have our 510K approval processed and ready to file. And we think within 2 or 3 months after that, we're hopeful that we will have FDA approval.
Well, your passion for what you're doing really comes across when we're discussing this. So why is this a good time right now to take a closer look at the company?
Well, Dane Medley, who's the CEO of the company, has been a wonderful stabilizing force with this company after a few unfortunate series of events. But he has stabilized the company, and we're at a point now where we are positioned for success. I've been consulting with a variety of companies over the last couple of years, and this is the one that caught my attention. So I am committing a majority of my time now with this company because it's positioned for success. We'll have some really exciting news coming out here over the next 6 months, with quite a bit of that being here in the short term, this month and next. So it is an exciting time for Imaging3. We are back on track, and we are ready to make this thing a big success.
Again, Imaging3, IGNG is their stock symbol. Go to imaging3.com for more information. Scott, we look forward to hearing more of this news that you promised us on later episodes of the program. Thanks so much for joining us.
I can't wait. Thank you so much.